Good morning. My name is Sue McCarthy Robinson, and I'm a nurse leader, and I've been asked to lead an interprofessional initiative aimed at addressing one of our healthcare system pressing concerns. My chief executive officer in our hospitals identified a key priority in our healthcare system. The goal is to reduce our emergency department waiting time for the non-emergent patients. I've been tasked with creating this professional team to address this clinical issue. We need to reduce the ED waiting times for those non-emergent patients. The long wait times not only impact the patient satisfaction, but also compromise safety and delay care for those that actually are having an emergency. To tackle this issue effectively, we need to collaborate a systems level approach. That means I'm going to bring together a diverse group of professionals that I think would be very important in this task. So my issue, the non-emergent patients are often waiting long times to be seen, sometimes due to limited resources that they're experiencing. There's triage holdups, due to lack of alternative care options. Reducing this burden on the emergency department will require input from both, I believe, clinical and non-clinical departments. The goal's not just faster service, but more efficient, appropriate care delivery that improves patient outcomes and enhance workflow for the staff. So identifying the team, who would be a great asset to my team. Definitely the emergency department nurse manager. I think this individual will represent, the frontline nursing staff the best. This person would have the insight to the current triage processes, the nursing workflow in the ED, some solutions to fast track things for the non-emergent cases. Definitely the emergency physician would be a key voice in assessing the medical urgency, the workflow inefficiencies, the patient flow. Their experience would be crucial in redefining, protocols, categorizing, triage, possibly, another primary care doc, maybe a family practice provider, would help us explore, referral pathways to as alternatives for instead of using the emergency department for then those non-emergent issues, maybe with some same day appointments or extended clinic hours. Definitely, I would want to have a case manager. This person can help identify those people that are frequent emergency department users and explore maybe some long-term care case management options to reduce those avoidable visits. A social worker would be necessary so that, could look at those underlying social determinants of health that may contribute to the inappropriate emergency department use. Maybe there's housing instability or lack of transportation or inadequate access to insurance. An urgent care representative, maybe I think collaborating with an urgent care can create some diversion protocols that are safely redirect the non-emergent patients to those urgent care centers. An IT analyst to assist in developing electronic tools, including improved triage, decision support, real-time bed tracking, definitely a QA quality improvement specialist to develop measurable goals so we can track the data to see how we're doing with managing this, so we can have some real evidence-based information. Patient advocate or that community liaison to be the voice for the patient in the community, I think is vital. This person can ensure that any solutions we implement are patient-centered and respectful, and we're addressing what the community needs. And then the team player for maybe the registration or front desk supervisor, so we can help streamline the check-in process and ensure that we accurately identifying those that are need emergent care or non-emergent care. So, my action plan, sharing that to develop that sense of belonging. My team will meet regularly to identify blocks, evaluate alternative care models, and design pilot programs. We'll share ideas, include implementing a fast track system for the non-urgent cases, expanding telehealth as an option, coordinating community education on the appropriate use of the emergency department. Success will be measured by reduced wait times, improve patient satisfaction, and more efficient, allocation of the emergency department. I believe by integrating these perspectives from the multiple departments, getting their input, we increase the likelihood of developing a practical, innovative and sustainable solution. The question is there a current culture conducive to development of the interprofessional teams? Why or why not? Our current tight-knit emergency room culture fosters the development of the interprofessional teams by promoting, open communication, mutual respect, and strong collaboration under pressure. The close working relationship and shared sense of purpose naturally support teamwork and coordinated patient care. Everyone has, great input. Anything that, we share amongst each other is always great, additive. There's no bad ideas. We always build upon each idea. What role do culture, values, and social behavior and customs play in fostering that interprofessional team development? Culture, values, social behavior, and customs shape how team members communicate, build trust, and collaborate effectively. When these elements align to promote respect, inclusion, and shared goals, they create a supportive environment. Everyone that comes through our emergency department is from different parts of the world many times. So we want to strengthen that interprofessional team development so that the team is strengthened and we can address all the cultures within our community as we try to meet the needs and in reducing the wait times and in caring for the emergent and the non-emergent issues that are going on in the community. So this initiative is more than just scheduling or staffing issues, about really transforming how we deliver care to meet the needs more efficiently. The interprofessional collaboration, yes, is key. I agree. Each member, of our team has a valuable perspective. And when we work together, we not only solve problems, we also really improve the system. I'm excited to lead this effort and confident that with the right team, and I believe I have the right team, we can significantly reduce the ED wait times for the non-emergent patients while improving the experience for everyone involved. Thank you for your time.